Namaste and greetings. I am Mahima Kapoor, researcher and assistant editor at IMPRI, Impact and Policy Research Institute, Prabha of devastation when the COVID-19 pandemic exposed the hollowness of our smart cities, weak healthcare facilities, dense settlements, and shaky social security nets. To revisit and rethink urban planning and implementation, we have gathered for a talk under the series The State of Cities #City Conversations with Dr. Glyn Williams on managing COVID-19 in India's cities, reshaping people's everyday lives in poorer urban neighborhoods. This deliberation is being organized by the IMPRI Center for Habitat, Urban and Regional Studies. I feel honored to introduce the moderator, Dr. Soumyadip Chattopadhyay. Sir is an associate professor at Visva-Bharati, Santiniketan, and visiting senior fellow, IMPRI, New Delhi. Welcome, sir. I feel privileged to introduce the speaker, Dr. Glyn Williams. Sir is a reader at the Department of Urban Studies and Planning in the University of Sheffield, and honorary associate professor at the School of Architecture and Planning, University of Witwatersrand, Johannesburg. He held previous lecturing posts at Keele University and King's College London. His research interests lie in the field of international development, and more specifically in the interaction between development programs, governance practices, and citizenship in the Global South. He is the co-editor of International Development and Planning Review and editorial board member of Contemporary South Asia. Welcome, sir. We are fortunate to have Professor M Vijayabaskar, Professor Debolina Kundu, and Mr. Sameer Unhale as the discussants of the session. Professor Vijayabaskar is a professor at Madras Institute of Development Studies, Chennai. Welcome, sir. Professor Kundu is a professor at National Institute of Urban Affairs, New Delhi. Welcome, ma'am. And Professor Unhale is the Joint Commissioner, Department of Municipal Administration, Government of Maharashtra. Welcome, sir. Now I invite Dr. Chattopadhyay to take the proceedings further, and we look forward to learning from our esteemed gathering. Thank you.
Thank you, Mahima. So, good evening from Kolkata and namaskar to all of you. On behalf of the Center for Habitat, Urban and Regional Studies, IMPRI, I once again welcome you all to this City Conversation series. Just to give a brief overview of this City Conversation series, IMPRI started this City Conversation series in 2019. Wide range of key urban stakeholders, practitioners, academia, representatives of the civil society organizations, international organizations, think tanks have participated in this series to discuss and debate on key challenges and opportunities for cities in developing countries and how to make them more livable, equitable, and sustainable. And such discussions are quite enriching as we live in an increasingly urban, increasingly inequitable world. And as Mahima has mentioned, this COVID-19 has exposed many of the gaps and fault lines in the existing practices of urban governance and planning. There is a kind of agreement of the view that these social and spatial inequalities significantly shape the outbreak and impact of any pandemic. And this is nowhere more evident than in the cities of India, where many residents face problems in their ability to access basic services, participate in the decision making, or to have their rights recognized as citizens. And where access to basic infrastructure is limited, it is simply not possible to transform daily life in the ways required and expected by the state, especially for a vast majority of the people living in margins. We witnessed how the millions of migrant workers in our cities were rendered vulnerable. They started moving towards the villages on foot, covering over hundreds of kilometers. Now, while it is easy to criticize public policy for overlooking the needs of low-income population, it is much harder to recommend alternatives. But at this point, it is impossible to ignore the shortcomings in the way our cities are made and managed. It might be a good time to look back at the way we think about planning and managing our cities. And local government and the grassroots organizations have already played a pivotal role in addressing the pandemic's challenges. And learning from these responses can create the foundations for what we can say equitable recovery strategy to build better cities after COVID-19. And to take this discussion forward today, we are fortunate to be joined by a group of urban scholars and practitioners. They are all renowned urban scholars, need no introduction as such. So Dr. Glyn Williams, who is the reader of the Department of Urban Studies and Planning, University of Sheffield. Again, I welcome you to this City Conversation series. Also, we have with us Professor M Vijayabaskar from Madras Institute of Development Studies, Chennai. Professor Debolina Kundu, who is the Hut Co-Chair, holds the Hut Co-Chair at National Institute of Urban Affairs, New Delhi. And also we will be joined by Mr. Samir Unhale, who is kind enough to join in most of these talks and share his experience on critical issues of urban governance and planning. And also we have with us Dr. Karen Coelho, who is the Associate Professor at MIDS Chennai, and Dr. Vinita Vithampi, who is the Assistant Professor at IIT Madras. So thank you once again for joining us. Now, without much delay, let me just move over, request our speaker today, Dr. Glyn Williams, to take over this virtual floor. It's over to you, Dr. Williams.
Thanks very much, everyone, and thank you for those kind words of welcome. Can everybody hear my voice okay? And I'm assuming you can see my title slide there, if that's all okay. Thanks very much. Yeah. So I've got about 20-25 minutes as I gather within the programme, and I'll try and keep my comments to that strictly to that time frame. So the project that I'm reporting on here is work that's very much work in progress, and this is one of the first presentations of that work, and very glad to be joined by my co-researchers, by Benita, by Karen, and by Darshini, with whom I've worked on different projects in the past, and their kind of breadth of insight into Trivandrum, into Chennai, and into Ahmedabad have been very useful, and have been very enriching conversations throughout this project and indeed the earlier work. So the project that we're working on at the moment is looking at three questions. First of all, how have cities responded to the COVID crisis in implementing national policy and in being responsible for innovative responses that might be coming at the city and at the state level. We're also going to be looking at how COVID changes lives and livelihoods within poorer neighbourhoods. And finally, we hope to say something about what these changes might mean for future urban change. The broader project is still very much ongoing. It runs until the end of this calendar year. And perhaps inevitably, because of sort of the repeated COVID waves, its fieldwork has been somewhat disrupted. What we've managed to do so far is work on secondary data, which has been a systematic looking through of government documents and directives, but also local English language and vernacular press within those three cities to try and see how the COVID crisis has unfolded within those cities. And we're following that up by a much more ground-based view of the impacts of COVID on three poorer neighbourhoods within each of those cities. So those are going to be selected, they have been selected to work with different forms of marginalisation or marginality that are present within each of those cities. And the qualitative first-hand fieldwork that's going on there is just being wrapped up at the moment, hopefully over the next couple of weeks. So today's presentation is very much work in progress, and it's also based around the secondary data collection. So it's based around the media reports and the policy documents that have been collated and taught at each of the cities. Now, I've got a long-standing interest, and I know COVID raises all sorts of different questions for urban futures, for planners and for others. But because of my background really in looking at the how the state interacts with society, I think it's questions about kind of everyday governance and the experience, how the experience of the state has changed, that are really kind of at the heart of this talk today, but also some of my kind of interests which are reflected within the project. And if I can move my slides on, I think COVID conditions, pandemic conditions, really cause those, a series of really quite important governance challenges, but changed experiences of the state for people living in all parts of the world. I guess in peacetime, we see some kind of almost unprecedented challenges for people who are doing the governing. They've got to be making critical decisions. They've got to be making those in real time with often quite limited data. They've got to demonstrate the capacity to implement these, and that means kind of all sorts of things, from kind of physical presence of materials, from vaccines, personal protective equipment, through to the systems necessary to kind of make those kind of get those to the front line or get those where they're needed. So it's questions about quick decision making, about capacity, but also about performance and the way in which performances of government showing that you are in control or you are able to manage the situation become really important. I've got a couple of photos there on the right-hand side that kind of anybody who's kind of following British news, have followed British news over the first year of the pandemic would have been very familiar with the nightly presentations, COVID briefings by our Prime Minister as a performance of governance, flanked, and the performance here really matters, on either side by senior health advisors. So his COVID task force advisors were flanked on either side. So not only do we have the symbolism of the British flag, something that's showing the kind of momentum of these announcements and their importance for people's everyday lives, but the government was being flanked by and led by informed scientific opinion. That's the performance that was being put there, and I think these performances become very important in terms of kind of maintaining order. For those being governed, on the other hand, there are some really quite major changes in pandemic era governance as well. Certainly, it brings different elements of the state into view. Boris Johnson is famous or infamous around the world, I'm sure. The person at the bottom of the screen probably isn't. This is my home city of Sheffield, and this is our Director of Public Health. Few people before the pandemic would have known that we had a Director of Public Health in terms of their interaction with the state within their daily lives. But Greg Fell was also giving local news, local information about implementation or actions that citizens needed to take. And his weekly podcasts were being downloaded by thousands of people. So, in some ways, the pandemic brings different elements of the state into view. It also means changed relationships with the state. And here in the UK, we felt those kind of as constraints on our freedom, and there have been kind of hotly debated issues about that, mask wearing, about freedom of movement. Those things have been hotly contended. But certainly that a different relationship with the state is something that's felt and often felt most keenly by those at the poorest end of society. Of course, that's been really important within India. So it's these governance challenges and what they mean for changing relationships between citizens and the state going forward that I think are some of the interesting questions that might throw open different questions about urban governance and the future of urban governance. I don't really need to rehearse kind of the dynamics of the pandemic here within India, but just to say that our project has taken as its time frame the period over the first 18 months of the pandemic. So we're asking people about their experiences of the pandemic up until the end of the second wave in June, July 2021. We're not going to include Omicron within the Omicron wave within our project. And in terms of the things that I'm reporting on today, it's particularly that experiences of that first wave that were really important. So, Kerala sees some of the first cases in early January. The experience of the national lockdown is very important. And I think one of the things that is already beginning to come through from our qualitative data, although I'm not going to present that here, is that almost it's the way in which the disease has been handled has been as important as the impact of the disease itself on those communities. So national lockdown, I think, is very, obviously a very important moment. Gradual unlocking from June 2020, and then of course a second and much more devastating Delta wave from March 2021. So if that's a national trajectory, national action in terms of national government actors and legislation are all very important. So we can see different parts of the state coming into view. The Ministry of Health and Family Welfare being very important for containment planning, for home isolation, quarantine guidance, and those sorts of things. Indian Council for Medical Research through the clinical management of cases, but also for testing guidance, but also the Ministry of Home Affairs in terms of issuing the lockdown and unlock orders, law and order measures that are important in maintaining governance during pandemic conditions. And of course, those actors, if they're forming policy, they're not doing so in a vacuum, but they're drawing on key legislation. So the Disaster Management Act of 2005, which requires states and local governments to establish disaster management authorities. The 1897 Epidemic Diseases Act, which imbues government with the power to declare a disease an epidemic and then take special measures and have those quite strongly enforced and punishable under the Indian Penal Code. So Section 144, Prevention of Riotous Assembly. These bits of legislation become very important in how the pandemic can be managed. So although there's policy formation and there are changing policy ideas, it's not just, what's really important here is that in order to get those through into implementation, that means animating a wide range of state personnel at the ground level, not just medics and health workers, but also the public health infrastructure, tied very closely to municipal and panchayat administration, and also the police. So in this talk, we're really stressing that the performance of governance by the state matters, being able to publicly project a sense of effective action in the face of a crisis. And this was clearly very important within the national response. March 2020, as we said, a rapid overnight lockdown, a very, very short notice, just a few hours notice, almost zero warning, resulting in great disruption. And this was an early, very centralized and very strict lockdown. And the images that circulated of India internationally at that time were the things that you can see there on the right. As Soumyadip has mentioned, the caravans of people, of migrant workers sort of being forced to emigrate from cities at short notice. Delhi with remarkably blue skies and remarkably clear roads where stray dogs could wander at their will, and also the public celebrations of frontline workers. So those images, I think, kind of that first lockdown were really quite striking, but the ability to empty the streets and to call out people to celebrate frontline workers, these sounds, the performances of kind of national strength and power on behalf of central government. Some of the performances as well, I guess, over a little bit later in the pandemic period, as vaccines are produced, some of the offers from India to help other states within the South Asian region and beyond in terms of vaccine dissemination, again, projecting India's prowess and power within the biotech industry, its global, its strength as a global biotech power to a wider audience. So again, these are important performances. And the last performance at a national level, I guess, would be March, April 2021, a delay over the second wave, a determination to present politics as moving forwards as normal within the round of state assembly elections that were occurring there. And almost if cases weren't particularly high when that first lockdown was called, cases were building up at this time, but the ability to say, well, okay, we're carrying on as normal and we can still call out massive political rallies. These are perhaps strong, there are strong echoes here of earlier instances of decisive action taken by the BJP national government. These are really dramatic performances of power. But there are all important questions here about to what degree some of these have been led by the science, or even more worryingly, these are performances of strength which don't come without real and lasting human costs. And these performances arguably show a willingness to disrupt lives and livelihoods of ordinary people within cities, and in particular the poorest, in order to protect that image of strong government and national unity. And so below this framing of a national crisis response, what our project wants to do is to try and really hear and amplify some of the voices of people in marginal urban areas who've been affected by it. Now, as I said, those voices themselves will come out later within our projects, but what we can already see within our work is that there is a difference in the way in which the crisis has been responded to, and indeed the nature of the COVID crisis between different cities. So although there's been a strong centralised national response, underneath that, I think there are very different stories about state capacity, state performances, and indeed a disease trajectory which is differing across different parts of the city. I'll just briefly outline that in the next couple of slides before wrapping up with some concluding comments. I'll begin with Chennai, and Chennai saw kind of a relatively early peak amongst our three cities, and in COVID in the first period in that first wave of lockdown. So its peak came earlier, and it was the epicenter of COVID cases for Tamil Nadu as a whole. The Tabligh Jamaat super spreader event was important in seeding cases, and the city's large central vegetable market, which remained open and crowded throughout national lockdown 1.0, was also a really important centre of transmission. Slum Clearance Board housing schemes, where there's densely packed housing, were further areas of concentrated cases. So Chennai gets this kind of relatively early peak of cases, and its response to COVID was initially slow. There was no elected municipal body in place at the time, at the start of the pandemic, and testing capacity in the city was initially inadequate. But there is then a rapid response from Chennai's municipality. We get over 5,000 people a day being tested from around about April and May. The municipal bureaucracy hires and deploys large numbers of staff and created decentralized monitoring and supervision teams for each of its 200 wards. So Greater Chennai Corporation is really important here in bringing doctors working in urban primary health centres to volunteer as unit health officers, tying in with sanitary inspectors and sanitary officers, and a vast volunteer or mobilised volunteer force, around about 12,000 surveillance workers working across the city, grouped into teams with surveillance supervisors drawn from frontline community nursing staff. So we've got kind of massive resources of the state being brought in here, and other elements of the state being important as well, with redeployment of police resources during lockdown, about 250 police officers assigned to special units of COVID surveillance and enforcement work. Micro-planning and coordination of these activities, however, came a bit later, but by June 2020, there was more effective coordination of ward-level action. So Chennai's story, I guess, is one of an initial slow start, but then mobilising mass resources of the state to try and contain and test for the disease. Trivandrum's pattern is somewhat different. Community-supported track and trace delayed a first peak in Trivandrum and across Kerala as a whole. Break the Chain starts as a model public information and community-based track and trace mechanism. And I guess Kerala here was in some ways fortunate that it had the experience of the previous Nipah outbreak to draw on here. So, one of the things I think that's important here when we're seeing state performances and state capacity is that local histories really matter within that. Thereafter, Kerala's cases didn't really die away in the way that they did within Chennai, and the story here is partly about repatriation of Keralan expatriate workers from the Gulf. It's also due to a range of different super spreader events, the Onam festivities and a couple of hotly contested local and state elections. Those things are really, really important. And within community transmission really taking off from July 2020, particularly within the coastal fishing belt of Trivandrum, this meant control measures in Kerala had to be moving almost in the opposite direction of the rest of India. So, lockdown measures continuing into the middle of 2020. It should be noted that although Kerala's numbers are high here, there are kind of big debates about the numbers. Kerala perhaps testing more effectively or more rigorously than many other parts of the city. Perhaps that means that some of these numbers are high, but still that slow decline of a peak seems to suggest that pattern of within community transmission had been delayed rather than sort of avoided altogether. Ahmedabad's story different again. Those numbers are low and perhaps suspiciously low. There are a number of things here in terms of local responses which perhaps reflect different elements driving systematic underreporting cases. From the 1st of April 2020, Ahmedabad Municipal Council was releasing daily lists of individuals who tested positive, including their names, numbers, and addresses, which the municipal commissioner said was a justified response in the public interest in order to get that information out there so that people who'd been potential contacts would know. This is backed up by the use of surveillance vans by Ahmedabad Municipal Council to track COVID suspects, mobile apps being used to geofence people who've reported themselves as COVID positive. But there's a at least within the media reports that our team have been looking at, there's perhaps a slight militarization or a heavy police presence or a policing element to the state's response here. The Tabligh Jamaat event was identified as a super spreader event within the city. There's highly publicized tracking down of the attendees using the Gujarat anti-terrorist squad, highly visible policing of the 9 gates bordering the walled city, and these actions seem to be important in driving stigmatization of the disease in general, and therefore perhaps providing a strong incentive not to self-report, but also perhaps in criminalizing Muslim COVID people as being suspects. So I think there are sort of elements about who the state is looking at here and whose attention it's focused on. Tough action really continued, fines against public spitting, etc. So things like that going on. And from August the 13th, 2020, the power passed from civic authorities to policemen to actually collect fines. So again, hardening a kind of policing response perhaps to the crisis. So I think that perhaps raises questions about whether those numbers are representatively low, or perhaps there are elements of systematic underreporting. Responses to COVID, though, are not just about kind of tracking and tracing or trying to contain and curtail people's movement, although those things are going to be, I think, very important within the lives and the livelihoods of the people that we're looking at in our 3 focus areas within each of our 3 cities. But it's about kind of relief and welfare and the things that the state has done to ameliorate some of the both the problems of the disease itself, but also of lockdown. In Ahmedabad, it perhaps seems of our 3 cities, the local state action in the city was less focused on relief measures and much more on perhaps law and order and policing. Effective means for relief, particularly within lower income areas, were delivered largely by NGOs and community support organisations. And for migrant workers, the expectation and the reliance is put on employers to try and provide food and replacement wages. And it's really only in the second wave that the Municipal Council instructed civil society organisations not to distribute food directly, but to channel relief through the Municipal Council. So we've got a sense really there of civil society kind of acting quite autonomously, at least within the first wave. Chennai has a very, very different trajectory, benefited from a state government that really quickly mobilised a package of governmental income support, using Tamil Nadu's extensive network of established poverty relief mechanisms. So we've got the universal public distribution system, budget canteens, community kitchens, income support given to family card holders. So there's a range of kind of welfare supports that are mobilised really quite actively there. Non-state action, relief action is actually contested. The High Court of Madras ruling on the 17th of April 2020 that there should be conditional permission to distribute relief by political parties and other organisations. But there is an attempt there to try and coordinate this with the concerned zonal officer, have services inspected, make sure that limited number of people are doing that, but not to penalise those sort of distributing welfare under Section 144. And what we can eventually see emerging in Chennai is good integration of community-based action, social welfare groups, women's self-help groups, and others with ward-level formal governance and management structures. So that eventually comes about, closely engaged with expert advisors. That's actually, that coordination comes in place. Kerala provides a rather similar package, sort of scenario to Chennai. Initially provided widespread financial wealth relief, backed up with innovative public awareness campaigns and online education during school closures, as indeed Chennai and others have experimented with. Health Minister KK Salaja was prominent in spearheading efforts in that first wave. Kerala also notable for supporting the 3.8 and above million migrant workers, predominantly poorer people from North India, resident in the state. And in contrast to that forced exodus that was so prominent in newspaper reporting elsewhere, almost 90% of Kerala's out-of-state workers stayed put, drawing on local relief services. So there seems to be a deliberate, in Kerala, a deliberate policy of focusing all relief and containment efforts on the local state. And clearly, kind of past histories are very important there. I'll just try and wrap up, because I'm aware that I shouldn't spend too much time talking. I should leave more time for my discussants. But there are kind of tensions here between public provision and social containment. Those are evident throughout all three of our cities. Chennai's wholesale vegetable market, I said, became a statewide super spreader, but that market was kept open to try and ensure that the availability of food and keep food supply chains active. So, there are real tensions in those difficult decisions made under kind of time pressure with imperfect information. Those things are real pressures for local government. But if we're trying to explain the differences here, I'm just doing this, just to sum up over a last minute or two, say very, very quickly what I think, there are different ways in which we could try and posit explanations for these differences. And, I think these have got kind of different and deeper levels of analysis associated with them. We could focus on individual leadership and innovation. I mean, here in the UK, leadership, or the lack of leadership of our current Prime Minister, is something that is, being very intensely debated just at the moment. And the way in which key leaders act, I think, is important, but it's perhaps a rather thin agent-based explanation. It sees particular figures as being important in shaping state or city-level responses. So local heroes could be important here. Figures such as Mumbai Corporation Commissioner Iqbal Singh Chalal, or Kerala's Health Minister KK Salaja, who got international media recognition for their public engagement with the Break the Chain campaign. Iqbal Singh representing almost a smart city data-driven response to the crisis. So different ways in which different key leaders react might be very important. But I think particularly when we draw on newspapers as our source materials, we need to be careful of any such explanations. When reporting stories, key figures like that are very convenient hooks for readers and for journalists to pin their stories on, and perhaps overly personalise what are deeper and more complex processes of governance. So our second suggestion for difference might be that there are incentives for everybody at the national, state and city level to play politics with the pandemic to some degree. A more game theoretical explanation for differences here would say, how get city and state governments respond to the pandemic depends on the calculus of political gain or expediency. And this might offer some explanations into our cases. For Ahmedabad, to be towing the line or to be upholding a story of strong national government would be important, perhaps, for a government that is in that kind of process of kind of mutual legitimation and recognition with a national government in Delhi. So perhaps trying to perform a vibrant Gujarat and a strong response to the crisis, those things are important in demonstrating the success of the BJP's line more centrally. For Chennai and Kerala, perhaps anti-BJP local governments had a different aim, to try and demonstrate their ability to innovate, to express local agency, or to be critical of national government. That could be an incentive to make political capital. It could be a high-cost strategy, and Kerala has had to fight with the centre to be prioritised for vaccine delivery over 2021, despite its recorded cases being quite high. But this space for kind of innovative political action more locally can see some states pushing to change national action, for example, on the price or availability of testing, or making vaccines free at the point of delivery. But our preferred explanation is really to try and look at deeper structures of governance, try and look beyond and behind these more surface level explanations and see differences between our cities as results of longer lasting processes of governance. This would see the capacity for innovation and action at the city level as a result of previous rounds of investment in structures of local governance. And it would see performances of rule and governance during a pandemic as guided by and fitting into pre-existing patterns of state citizen engagement. There's certainly considerable space for improvisation here, but these performances are likely to be shaped by pre-existing scripts. And for Tamil Nadu and Chennai, that institutional investment is evident in the presence of a strong welfare state and pre-existing health initiatives in particular, such as the Tamil Nadu Urban Healthcare Project, Tamil Nadu Healthcare Systems Project, which are working on improving healthcare systems with a particular emphasis on the poorer sections. That perhaps means that there is that infrastructure there to draw on and to innovate with those kind of patterns of community-based monitoring and coordination of the state with civil society organisations. So those past rounds of investment really matter. For Gujarat or Ahmedabad, by contrast, there's been a history of privatisation, perhaps hollowing out of the welfare state, and a culture perhaps of political centralisation. That means that some welfare measures reported were perhaps less effective and could still it was difficult not to draw attention away from some of the poor quality of previous rounds of health investment and what that's meant for people reliant, particularly poorer sections, reliant on public health infrastructure such as Ahmedabad City Hospital, which saw round about kind of half of the COVID deaths kind of within the city as a whole in the first wave of the pandemic. For Kerala or Trivandrum, this is not only the story of empowered local governance that's provided a robust system of primary health services and strong state-focused networks through which its civil society can be mobilised, although that institutional investment is really real. I think the more proximate experience here of the 2018 Nipah outbreak, the 2019 floods, these provided powerful scripts to guide local state action, local innovation, public engagement, and even philanthropy. So schemes such as kind of the scheme for public sector salaried workers to donate to the Chief Minister's Special Relief Fund, that was already something that was, a kind of mode of action that could be drawn on locally. So I think those deeper structures really help to explain some of the differences that we can see in how the pandemic's being experienced. But throughout, we need to be sensitive to the possibility for local difference within these regions and within these cities. Things may look and feel far different from the perspective of frontline workers or particular marginalised communities who might be on the receiving end of containment actions or marginalised from welfare or welfare measures, which is where our research is going next. And our final rounds of interviews with city officials and the discussion and dissemination of our results will return to the question of possible urban futures indicated in these patterns of governance. As we've presented the story thus far, COVID may be entrenching existing patterns of state-society relationships that already exist within and in different ways within different Indian cities. But our hope is that by sharing experiences across cities, and within that, amplifying the voices of marginalised groups, that might point to alternative and more inclusive urban futures. And I'll leave it there. Thanks very much.
Thank you, Dr. Williams, for a wonderful presentation. And you have highlighted the governance challenges amid COVID-19 with the details of new actors, rules of governing, the role of importance of legislations, capacity and leadership issues, their suitability to local conditions, and the modes of governance, and finally how they shape the COVID responses and their implications for future urban change. There are variations in the modes and nature of responses, as you have mentioned, like municipal bureaucracy spearheaded the responses largely in Chennai, while in Thiruvananthapuram, the story is more about the involvement of the local bodies and community support. And also in Ahmedabad, witnessed more focus on state enforcement, like policing measures and all these things. And in Chennai and Kerala, the responses were more about financial relief, the innovative public awareness campaign, and some form of good coordination with the community-based organizations. And regarding the triggers for these differences, you have highlighted the importance of factors like leadership and political differences, and more in addition, you have emphasized on the issues of local capacities by linking it to the history of well-crafted local government structure and associated patterns of citizen engagement. So it's a wonderful presentation. So let me, with these things, let me now open this floor for more discussion. So may I now request first Professor Debolina Kundu to please share your comments or views. So what do you?
Yeah. Thank you. I would like to take this opportunity to thank the organizers for inviting me to this very important research presentation on managing COVID-19 in India's cities, reshaping people's everyday lives in the poorer neighborhoods. I think this topic is very important, and I would also like to congratulate the key presenter, Dr. Williams, and his entire team for taking up this topic for research, which I mentioned is extremely pertinent and which has great policy implications. The three wider research questions which the project addresses, namely, how have cities responded to this crisis in implementing policy, and also with regard to coming up with new innovations? How has COVID changed lives and livelihoods within poorer neighborhoods? And what do these changes mean for the future urban change? All these three research questions are extremely important, and over the last 2 years, I think several research organizations, individual scholars, and universities, to name a few, like NCAER, Azim Premji University, the National Institute of Urban Affairs from where I come, and others have delved into this topic, taking cities of different size classes, city periphery relationship, to understand the implications, and even within the city, the different types of neighborhoods. And they have tried to understand the implications of the impact of COVID on lives and livelihoods. And I'm also aware of the fact that today's presentation took us through what the key presenter, Dr. Williams, did mention was work in progress. And here, when we talk about city governance, I think it is important for us also to recognize how city machineries were repurposed to meet the COVID crisis. Just to explain, we are aware that the cities under the Smart Cities mission, they have, most of them have the integrated command and control centers. I think for most of the cities, these machineries were repurposed to convert them into COVID war rooms. And also the resident welfare associations in the high and middle income groups, I think they became major agencies to manage COVID in their respective neighborhoods, which I believe the poorer neighborhoods did not benefit from. I would also like to share the research findings from two research studies which we undertook. One just when the pandemic struck us early in the early 2020s, and the second one was conducted last year in August, September, across 12 cities. The first one was across 12 cities, that was through telephonic interviews with people living in the low-income areas, basically the slum dwellers. And the more recent one was based on a rapid survey of slum dwellers across 10 cities in India, where we were fortunate enough to conduct a primary survey. Face-to-face interviews were conducted through structured questionnaires in both notified and non-notified slums in Aurangabad, Bangalore, Bhopal, Delhi, Indore, Jammu, Jodhpur, Lucknow, Pune, and Ranchi. About 120 households were surveyed in all these cities. And again, we tried to understand the impact of both the waves of the COVID pandemic. And I will take this opportunity to share a few of our findings which have relevance to what was discussed and which may help the group of researchers present here to also probe their research on these lines. I believe they are doing, but I thought the reflections of our findings may be of help to the larger audience here. What we found was that about 12% of the respondents, they tried to go back to their native places, even in the second round. But they were challenged mainly because of the transportation cost. They already ran out of money in the first wave, and the second wave, the transportation cost was one of the major hindrances. And the second one was the mandatory RT-PCR test. And again, fear of institutional quarantine when they go back home, as well as not having a space, an adequate space or a separate room in their native places for quarantining. And one important finding, I think all researchers in today's online platform will agree with me, is that this pandemic has laid bare the vulnerabilities of the marginalized sections of the society. It is not that something new happened, it was already there. It is only that the pandemic laid bare the vulnerabilities which were already there. And one important finding from both the studies which we conducted was the emergence of a new class of poor. Those who were above the APL, they were hard hit, and what we found was that the daily wage earners or the casual laborers were the most severely affected because of this pandemic. Also, many casual workers started working as self-employed, selling vegetables and fruits after losing their more regular source of income, which was also casual work, but even they lost that source of livelihood. Also, the economic impact of job loss was less severe during the second wave compared to the first wave, as during the presentation we got to learn, and we all are aware of the fact that the second wave, during the second wave, the restrictions, the government imposed restrictions in terms of lockdown was much less severe. Also, the households relied heavily on savings as a coping strategy in the first wave, when they lost their jobs. Whereas during the second wave, they basically resorted to taking loans from their social networks because they had already, the savings were already exhausted. When we looked at the basic amenities and housing facilities, what we found was that access to individual water connections and availability of rooms for quarantine purpose were challenges mentioned by most of the people whom we interviewed. And this stood in the way of maintaining COVID appropriate behavior. Among those who sought treatment for COVID, I think there was mentioned during the presentation that many of the people who were affected did not mention that they were affected. I think there's still some social stigma attached to mentioning that. And among those who said yes, we were impacted, 85% used government facilities. Among various sections of, when we look across age groups, I think it is the children who are school going who have been impacted the most. And from our study, we found that 35% of the school going children could only access the PM portion of the midday meal scheme. Because when we asked this question, many of the households did mention that they were not aware that dry ration was being distributed along with the normal ration. Only a third reported access to uninterrupted online learning in the age group of 6 to 18 when we canvassed this question. Many could not have access to the online classes. And because of poverty, 17% of the children dropped out from school. And the main reasons they cited was that they were unable to pay their fees, or they had to enter the labor market at the school going age. We also had a question on the COVID appropriate behavior. 66%, which was a high share among the low income group. They did mention that they reported practice of physical distancing, hand washing, and use of sanitizers. So all these three were there for 66% of the people whom we interviewed. And a very striking finding was that 2% were totally ignorant about COVID appropriate behavior. And I will not go further. I just have a few policy implications which I would like to share with this audience. I think it is important for the government at the central level, at the state level, and at the city level to really track both health impacts and livelihood conditions, because both have been impacted and are being impacted by the onslaught of COVID. There is a need for a greater investment in housing and basic amenities. The government of India has taken up the fifth vertical of PMAY by providing rental accommodation to the urban poor. I think that really needs to be strengthened. We are also aware of the digital divide which is happening, and there again measures need to be taken to reduce this digital divide, which is again impacting the poorer more adversely. And when we talk about regional development, we are still stuck in this rural-urban divide. We look at these two sectors as mutually exclusive. I think time has come where we really talk about more linkages in rural-urban planning, and initiatives should be there to really strengthen the rural-urban linkages. And decentralized urban governance, I think that is one of the key areas. When we talk about local governance, it should not be limited to the city level. I think beyond the city, at the neighborhood, at the ward level, through ward committees and area sabhas, there needs to be much more decentralized governance practices. And I would end by emphasizing that primary health, which is to be accessed through the primary health centers, that really needs to be strengthened, along with sensitization of the people without whom cities come to a standstill. I think understanding the vulnerabilities of the poor and really trying to mainstream their concerns is one of the key challenges we need to address. I stop here. Thank you for this opportunity.
Thank you, Professor Kundu, for sharing the findings of your study. In fact, just let me take this opportunity to mention that we at IMPRI also did a similar kind of study during the first wave of COVID-19. And what I have found out that the situation, since you study mostly covered you also covered the second wave of the COVID-19. the situations more or less remain same. The problems that the urban citizens are facing, they are more or less remain same. And just only with the exception that their economic resilience has improved, because you mentioned about there are some improvement in their economic conditions and job related aspects. So anyway, so thank you once again for your for sharing your thoughts and views. Let me now move over to Professor M Vijayabaskar. If you so please.
Yeah. So thank you. Am I audible?
Yes.
Okay, thank you. So I apologize for not being able to. Okay, I'll just start my video. It's just that I'm traveling, and so the background might be a distraction. So and also connectivity has not been good. So I've already lost connection twice. So I'm going to switch off my video if that's okay with you. I'm sorry about that. Yeah. So thanks for inviting me to be on this panel. I'm happy for two reasons. The fact that the kind of questions that this project raises are extremely interesting, and second, of course, has to do with the fact that the project is being done by a set of good friends and colleagues as well. Coming to the paper, I'll just say I'll be kind of brief, and I'll try and kind of highlight 3 or 4 points which I think might be worth kind of considering. That is what I felt. To begin with, when you frame the comparative perspective, when you frame the comparison between these 3 cities, you start by looking at the outcomes and then trying to kind of interpret, what explains these differences. But I would probably think you may be better off trying to say why you chose the 3 cities to begin with. The fact that are they kind of embedded in particular kinds of subnational regimes, and then see whether these regimes kind of matter, or are you talking about the differential relationship vis-a-vis the dominant political parties in power in these 3 states, and the kind of relationship that they have with the union government, and whether that has a role in how the cities or the subnational regions kind of innovated. The second thing is, I'm not saying that you don't do it. It's there. Probably there's a case for kind of bringing that out a bit more clearly than what it is at the moment. I'm basically responding to the write-up that you shared with us, Glyn. The second thing is, see, the fact that when you talk about how important it is to understand how this performance reproduces this process of governance, I think that's a very, very interesting question. But having said that, probably there's a case for again highlighting how studying the governance of this pandemic adds value to what we try and do in the case of other issues. I think so that would be particularly as of now, it doesn't, the pandemic and its dynamics, the specificities, and the fact that this virus, there's about control, about spread. I think how that kind of shapes the kind of responses would be worth emphasizing. And that takes me to the kind of explanations that you offer, which is essentially, you emphasize the pre-existing script and the role of previous structures of mobilization and how this mobilizational politics gets embedded in governance structures and so on. That's your primary source of explanation. I'm completely with that. But having said that, it would be interesting to kind of ask how such scripts in themselves are destabilized by the specificities of the pandemic. Yeah. So does the pandemic actually disrupt the scripts? And if yes, how? And then it's worth asking then how do these scripts get reenacted, when it tries to kind of regulate or kind of perform a pandemic control. The other kind of what shall I say, ambiguity I sense is in the scale at which you offer explanations. Yeah. Now, is it at the level of the city specific governance structure that explains, or is it the subnational structures of governance? From the kind of explanation that you offer, it seems the subnational experience, subnational structures, which seem to drive the differences that you find at the city level. But there's something I don't think you emphasize well enough in the whatever write-up or in the presentation that you make. So it's worth clarifying is my feeling at this stage. And the other thing that struck me was these uncertainties. I think the important point, Glyn, that you make is the fact there's a huge amount of uncertainty in how the pandemic kind of unfolds, and it generates a huge amount of governance challenges. And what it also does is also opens up some spaces for uncertain responses, unproven responses. A classic example in the case of Tamil Nadu is prescription of Siddha medicines, for COVID relief, which I find it very fascinating because the government suggested that it can be it prescribed it in public hospitals and so on, which I found quite interesting. And finally, the point about local political culture, it's interesting to ask how the local political culture shapes the negotiation of suspension of rights with the onset of the implementation of the Pandemic Act and so on. You do talk about differences and overlaps in the kind of policing of our neighborhoods. It would be again worth asking, how do we explain these differences in the way policing took place? Was there a counter mobilization to such policing measures, and how the local government responded to these maneuvers at the local level? That is something it would be worth mapping out to show how city level governance responded to local politics to negotiate the suspension of rights, suspension of mobility, and so on. And my last point about Kerala is there's a lot of emphasis on civil society groups and initiatives and local government experiments. Is it also worth thinking about the role of party society, in the mobilizational and efforts, and how that was used to disseminate information, initiate process of tracing, and so on. Yeah, so these are the observations that I had, and thank you again for having me over. Thank you.
So thank you, Professor Vijayabaskar, for raising some very important issues. So we have another discussions with us, Mr. Samir Unhale. So it's over to you. Yes, Mr. Unhale, can you hear us?
Yes, I can hear you. Thank you. I hope, first of all, I would like to thank IMPRI for conducting this series, because it's very important that the administrative experiences of the practitioners do get documented, and they are available for the academicians to, as an information or data, to be put into some broader theoretical framework, because very often it happens that whatever work is being done, out of shyness or out of reluctance, whatever, it doesn't really get documented and is not made available to the academicians to the way it should be. So thank you for this opportunity for someone like us, who are working with the local bodies for that, number one. Secondly, I think looking at the poor neighborhoods in Indian cities, or for that matter, even developed urban nations like United Kingdom or USA, or even and the global south like Latin America, Africa, and Asian cities. I think the situation of poor neighborhoods would be relatively comparable as far as the position in the access to urban services and infrastructure are concerned. That probably is my first assumption for continuing the further discussion, that the situation of poor neighborhoods in any city of the world will be in a similar disadvantage as far as the cities are concerned. If it is a rich city, the poor might be less poorer than the poor of poor cities in poor countries. That could be one of the way of looking at it. But I think if you try to make poor neighborhoods as the focus of the deliberation, then I think it becomes a very important understanding that the poor neighborhoods all over the world do face similar kind of as they say, the social indices for health or the reasons for their poor health. Because anywhere, whenever we talk of poor neighborhoods or in Indian context, the word we use is very often slums or juggi-jhopris or that kind of localities. So I think this was my first understanding that because I would like to share here that, informally we had done some webinars connecting the cities of Latin America, NGOs working in Africa, cities from India, Maharashtra, and even Delhi and Gujarat, and then some cities from Malaysia and Philippines. This was like more of a personal or individual effort done to connect the city mid-level city functionaries of the city government, because very often the political executive or the administrative executive, he becomes the focus of the deliberation, but the real cities are managed by the mid-level functionaries like sanitary inspectors and health workers and maybe the sub-engineers and those laws. So it was an attempt to do that. And what I would like to share here was that we learned that the situations across cities are fairly comparable, and that was actually a bit of a surprise for us. We didn't really expect that Buenos Aires or maybe Pimpri-Chinchwad here or maybe something where in Philippines would be, the city functionaries would be facing a similar issue and challenges. That was one of, it is not academically rigorous inference, but just an experience I thought I should share here with the audience, that that something gives an opportunity also for us, even for the academic circle, that the studies which are happening in urban sciences right now, or urban affairs, are either they are planning centric, mostly done by the land use planners and architects, or then by political scientists. And I think we should use such opportunities to get all kind of disciplines, working on urban issues and urban affairs, so that we could have a greater understanding, more realistic understanding of the urban challenges that most of the cities of the world are facing. Secondly, specifically talking of managing COVID, and there is, of course, every municipal act also has provisions. Even in India, of course, our speaker is from the United Kingdom, so we have the municipal laws of India and probably UK are fairly comparable, because they have been taken up from the Proto Boroughs Act and the municipal governance. Essentially, we do replicate what the British government really does there to an extent. With, of course, the modification after the 74th Constitutional Amendment. So, as far as the statutory framework of managing such pandemics or epidemics in Indian context, there are two additional acts I thought I should share with our audience. One is the Criminal Procedure Code, the CRPC, which does give certain rights to the district magistrate to ensure restrictions of particular types. It can be movement, it can be group, it can be timing. So that also at the Criminal Procedure Code, CRPC was also used. And secondly, of course, was every municipal act has provisions which are as the nature of the sections are very similar, but probably the empowering nature or the power for municipality to enforce that is fairly limited, because most of the municipal offences in India are still civil offences. It's not that you can use the Indian Penal Code to, look at the transgressions which are done into the municipal act. That I thought is a legal framework I could share. Thirdly, I think I always felt that the political leadership at local level, I'm not talking of the national or state, but at local level, I think was extremely proactive. This factor somehow, probably doesn't come up many a times, but I've found that I worked in two cities and also at the state level responsibility during this pandemic up till now. And my experience was that the local politicians, the councillors, the would-be councillors, or someone who couldn't be a councillor, who want to be a councillor, there's others, network of smaller NGOs which are there. I think they are very proactive. I think that is something their contribution in these, especially the first wave, when things were very unclear. We were not very clear as to what's happening, and if I may be forgiven, but the police state model of containing quarantining and restrictions which somehow came up from whichever country that might have started it. It was a bit confusing in the initial phases. Psychologically, it was also very tiring actually to the people who are working frontline, as well as the citizens also. So that initial phase was a bit confusing, and in these times, I think the local political leadership, the workers, political workers, the community workers, the NGOs, I think they did a really marvelous job of bridging this area. They used to be constantly in connect with the local officers, with probably people like us also, and try to relay that back to the ideas. In the initial phases, of course, the tracing, the model was tracing, track, trace, and treat. Through isolation or quarantine. So that was the model which was dominantly used. So I think this political workers did a good job in bridging the initial phases of that. Secondly, of course, again focus essentially on the poor neighborhoods. I think in the methodology of disaster management that we look at any such sudden change. One, of course, is we have to be excessive. We have to try to rescue the situation, and then of course give relief to it and rehabilitate. That's the CR that normally we use. And I think this methodology could also be useful for when you are considering the issue like a pandemic, especially in the poor neighborhood of cities and towns. That okay, the initial phase, of course, was the rescue and relief. Like the measures for you, someone gets infection, then obviously in a very dense area, it is bound to be really explode in a way. Of course, in sharing some experiences from the western part, of course, the Dharavi model of the Mumbai Corporation, it was also often acknowledged that some activities in which municipalities created big isolation units, big quarantine units, big jumbo hospitals, and especially for after the tracking and tracing, the isolation and quarantine was done to a large extent by the municipal body, especially in a very compact, even slum like Dharavi. And also that was replicated in all the models, especially in MMR also of municipal created quarantine isolation centers. So I think that was something which also I found a particular characteristic, peculiarity, especially when dealing with the initial phases of the poor neighborhood. One list, of course, Madam also told about the use of the smart cities and the control rooms also, which also we also did wherever possible. And I think one experiment again, which in fact I was shared by a senior functionary from the BMC, that the innovation of using data which was available with the ICMR website and getting it to the BMC website data available, and then it was distributed to the 24 ward officers. And these ward officers used to proactively reach out to the patient before they knew they were positive. And I think this was a very good model actually, which came up here in Mumbai, BMC especially, that before the patient used to receive the report, the proactively and in helpful way, the municipal staff used to constant touch with the person, his family. What's your problem? Do you have any issue? Do you want some support? Do you want vehicles for you? Do you want an ambulance? Do you want some other support, medicine? So this, I think it was a unique way, and possibly especially because of the data which was available and the electronic format in which it was created and collected, which initially was hardship to even us. And we used to feel what you're supposed to do, filling the data every time. But I think it afterwards, when the quantum and the quantity increase, it's only the ICT which can manage that data and let you know what you want in that short time. So I think this also an experiment done by the BMC for specific, when I look focus at the urban poor neighborhoods, that hyper localized focused targeted support to the individual. You won't believe that there was a control room. Every ward office, there will be people of say 50 people constantly phoning on those 24 hours. What's your problem? Do you want any help? And I think it's created a tremendous amount of goodwill about the local body, that you are getting cared and someone is asking you proactively, do you want some help or not? Considering the whatever the level of expectations people have from government or local bodies, whatever. So it was, I think, another experiment I thought I should be sharing with you as far as the typical focusing on the poor neighborhood. Next point I thought I should share was that when you are looking at this particular pandemic in a framework of disaster management, like, you initially had your rescue and relief, like you identified the person, you tracked it, traced it, the first level close contact, other contacts. You got them isolated, you gave whatever treatment is possible, the initial phase of rescue and relief, which is normally used the disaster management framework. After that, I think the rehab part is something which would be required with the continued engagement, the interaction, especially in the poor neighborhoods, because in those initial phases, of course, as was said by ma'am also, that initially when the first lockdown, and of course when it was progressively released, there were some limitations on traveling and on and off, and it was changed as per the requirement. So in these times, certain measures were done, like the direct benefit transfers were done to an extent in which the street vendors were supported by the National Urban Livelihood Mission. Even the state government also supported a string of other people like drivers, rickshaw drivers, and other such people by direct benefit on the initial phases. As an economic support to residents of the poor neighborhood. So I think the immediate relief part and rehab part, I think, is going to be much big, because of course we do talk of the demand which is there, but it is unlikely that the impact of the pandemic, it is hard to believe there won't be any impact at all on the economic front, maybe in short term, maybe after 8 quarters, or we don't know how the economy will respond to it, because probably there are indications that there might be some adjustments that needs to be done. And as always, the residents of the poor urban neighborhood, whichever country they are, for that matter, will require some sort of rehab support, in maybe educational support, maybe in health support, in skilling, in upgrading the skills, in maybe changing some skills, if at all. And this support, I think, will be required, at least in my view, for at least 8 to 12 quarters will be required, because as we don't know how would the economy be responding, really speaking, in coming days, because we could of course get her to maybe for 8 quarters now, but still there has to be some impact. We have to be ready for it. We have to think of some strategy, operationalizing how to go about it, and some plan of action needs to be ready. And I do feel this, especially as we have very senior academicians like Dr. Kundu, Professor Vijayabaskar, and Dr. Williams, and of course Dr. Chattopadhyay, that this what we are discussing here, in my view, is applicable to all the cities of the world. It's not that it's going to be only with a couple of cities. There might be some change of degree, and therefore this calls for some greater collaboration and cooperation. I always say that the practitioners and of course the people who are working in clerical roles like us need to talk to each other much more frequently. And there has to be a lot of collaborations and discussions, so that because very often I find that what we do in office, what gets reported into newspaper, and probably what reaches to the academic circle is, it's I don't know, it's like comparing oranges and mangoes and coconuts at the end of the game. And that's why I feel that is the time. Of course, earlier we had system of, we were supposed to write diaries and submit to our superiors for approval. But these are probably in times of WhatsApp, it's a WhatsApp message of a few words is probably taking the role. But I think a need of sharing the experiences, working experiences, practical situations is much more there. Probably, I think maybe I will just add 2 sentences now. I think I exceeded my time now. One was that regarding the regarding construction laborers, it is an experience I am sharing, that it talks of digital divide normally is relevant, of course, but I'm just sharing an example in which it was in the first wave, of course. It must be a month of maybe initial, I think, first or second week of May 20. That time, there was a construction laborer staying in a his office took the cognizance of that, and through the state hierarchy to the chief secretary's office, it came to us in the city where I was working, and it was unbelievable that within 2 hours we could send a person with a dry ration to his place where he was staying there. Even he was surprised how we could reach to that place in 2 hours. And after reaching there, we found that his room was filled with dry ration, in a sense that there was no, it was more of his emotional distress. That in kind of stress, we want to be with our home and relatives. It's the you and with me, we want to be with our friends and relatives when there is a emotional stress, and that was the reason he put that. But the use of technology, the accessibility of these technologies of social media and smartphones is now available across the spectrum to even our brothers and sisters from a poor neighborhood also have access to it and are using it also. So in fact, I also shared that we had done a small survey of among the tribal hamlets around the Sanjay Gandhi National Park, the eastern rim of that, where we were working through the smart city. And we found that there was, of course, it's not an academic rigorous study, it was more of done by our school teachers there. But what the figures show that there is no much difference between the access and the use of the smartphones and the purpose for which it used between the scheduled tribe and the poor and the other users of the city. That was, I think, that the force of technology is such that it is trying to be made accessible and available to all the wings of our society. And we do hope that probably these technology tools will, to a great extent, help our citizens of the poor neighborhood to access the various services and infrastructure, and also hope that probably cities should go ahead with the job of using greater and more important technology for the residents, for the service delivery, as well as the personal interaction interface with the individual and the city. So I think, Soumyadip sir, I think I exceeded my time limit. I could go on and on, a lot of things to share, but I think that could be done for some other time. And thank you, Dr. Williams, especially for putting your efforts to studying our cities and giving us the feedback to help us, work and improve on that. So thanks a lot.
Thank you, Mr. Unhale. I think Dr. Williams have lots of questions to answer. So it's directly, let me just request him to intervene and comments on the points which have been raised by our discussions. So what do you?
Thanks, and I'd also, if Benita, Karen, and Darshini want to chip in at any stage, please do say. But from Dr. Kundu, Professor Kundu, it was very helpful to hear those the statistics of the impact, and I think this is something that the second phase of our work will really zero in on. And also, as well as trying to put that into numbers, try and put that into people's stories and people's own voices. So how that was experienced. I think there's a really nice connection there between, the statistics that you started with from your survey and that experience of the construction worker that Mr. Unhale ended with there. That it's actually, there might be all sorts of things that are not just about access to materials that are a problem. There might also be kind of psychological scarring. There might be erosion of social networks, and some of these things need to be. I think we need to listen to these voices to actually understand, within these communities, to actually understand, the depth of these problems in a little more. So I found, a 10-city and a 12-city comparative study. I would really like to be in touch and hear a little bit more about that, and hear how that could inform the second wave of this concluding part of our work as we move into communities. Vijay, fantastic questions. The comparative question Are we looking at, scale in this piece is a little bit of an ambiguity. Is it states that are drivers or cities that are drivers? Certainly that question about how much local political culture pushes back against policing or a policing heavy kind of intervention in the first round in the opening months of COVID, I think is really interesting. And there, it's wrong to caricature, and this is me as an outsider without having had a chance to discuss these findings in great detail. But the media reporting of police officers in the streets of Gujarat being gifted buttermilk for their sacrifice to the nation, and the excesses of policing within Kerala, where there were commandos being deployed within fishing villages that we will be looking at in more detail, kind of a much more kind of civil society pushback against some of that. So I think some of these differences in political culture will come through from our work. The comparison and the international comparisons from Samir and Unhale, I think those were really, really interesting. And I think there is something very interesting when you put middle level civil servants, bureaucrats, municipal officers of whatever cadre they might come from. When you put them in a room together, I think really interesting conversations do happen. I had the ability to do this maybe 20 years ago with a colleague in Bihar when we were looking at local decentralization of local governance in rural Bihar. Fascinating conversations come out as ways of sharing those stories across different contexts do really produce very, there's a lot of intelligence in the room that actually comes out, and a lot of insights in the room that comes through there. I think also the observation that political leadership at the local level was very, very proactive and was really important at being a feedback mechanism between communities and structures of governance. And I think that is going to be something, again, that comes through from our qualitative work. It'll be something that we will be listening out for very, very carefully. And I think it perhaps will speak back to some of, some of Vijay's questions where, the nature of the pandemic itself needs to be emphasized. The newness of this, how was this changing existing political scripts? And I think, those people, because of their social position, and their, as councillors, or as you said, councillors or would-be councillors, those operatives within political society who are really, really important as conduits of information. How are they having to adjust their behaviours or adapt differently? I think, again, if this can come through from our qualitative work, that would be hopefully doing an important service as well. But I'd just like to thank again the organisers for this chance to speak, and also to the three discussants there for what some really really interesting food for thought. Extra data, extra insights, and extra questions, I think, coming through from all speakers. So thank you very much for that.
So thank you, Dr. Glyn. And before just concluding this session, since Professor Mahadevia is here, so may I now request Professor Mahadevia if you can just add to this discussion. Yes.
I'm sorry, I wasn't prepared to speak, but I agree with Mr. Samir Unhale, and that as the pandemic has progressed, the local state has learned partly how to deal with it. And so as we present our next round of findings and analysis, I think some of these arguments would get sharper. I would also request Debolina, if you have a report of this study that you talked about, if you could share with us, because it will be really very, very useful for us to refer to a larger study that has been put in place. I also liked, I think our friend Vijayabaskar is not here, I liked the idea about when we define local state as to whether we're looking at the subnational state or the municipal level, because the boundaries on the character of that state often overlaps. And in the Indian situation, given the centralization of governance at the state level, because the urban local bodies currently are sort of directed by the state, not just in COVID, but in all others. So planning is regulated at state level, not at the local. And all of us know the story of 74th Constitutional Amendment not being sort of implemented. And so I think that's a very useful point for us to look at the scales of governance and how that operates in each particular case that we have. And lastly, the study that, so just for everybody else within the city also, we've talked about the city level story, but within the city also, there are differences in the way the regions, local areas, sort of the experiences of local areas. And there is going to be a story of how historically certain areas have evolved and what has been the governance and various community state dynamics at that level. So it's a very complex sort of relationship and different scales of governance that we are sort of trying to wade through. So let's see. And thank Dr. Soumyadip for inviting.
No, thank you. Thank you. It's nice, always nice to hear from you.
Can I say one thing?
Yes, please.
If there's time, is there time?
Yes, you can. Please.
Okay, so I think just one point that I found very interesting, again, drawing from what Vijayabaskar said about, the mode of governance. What does the mode of governance during the pandemic suggest for, other times? And also drawing from what Mr. Unhale said about, this can be compared to disaster management in a way. And one of the things that from working, on the ground in one city struck me was that this mode of governance of the pandemic was very much one of just deployment, right? Everything was deployed. So there were ideas, innovation, staff, surveillance, everything went from the top to the ground maybe in a very decentralized way, depending on how much resources the city had at its disposal. So they were able to reach everybody, but everything went from the top to the bottom. The thing that I felt came out from our field work is that almost nothing went upwards except for data. There were no insights, there was no feedback, there was no sort of learning from experiences on the ground that traveled up through that deployment mechanism. So that there was, and so in this sense, I think the pandemic offers a mode of governance like disaster management where things are just deployed, in one direction and nothing comes back. And I think that's been a huge failure actually of this model, because what we do find from the ground is that the gap between what people experienced and what was sent down to them, deployed down to them in terms of messages, resources, support, anything was huge. The gap was huge. What they suffered and what they were told or given had no connection at all. So this is just one. I just want to say that the mode of pandemic governance, one of deploying governance, is really quite specific. And yeah.
Thank you, Dr. Karen. And I am also saying Dr. Vinita is here. If you like to add something to our discussion.
Well, I'm thankful to all the comments and suggestions made by the discussants. I don't have much to add, but one or two points, particularly the comments from Professor Vijayabaskar. The question is whether it is city or subnational level or city level. I believe that comparison is very interesting. Often you find a combination, sometimes you find significant divergences. This is all the more relevant, I believe, in the context very recently, a day or two ago, Prime Minister has decided entrusting more responsibility to the district administration. So we'll be seeing a very interesting different picture henceforth, maybe in the context of the upcoming state elections. That's one thing. The other point is specifically he talked about, and also these three states, if you look at Ahmedabad, Gujarat aligned with the center, Tamil Nadu and Kerala, we have seen in one state continuity in governance, whereas change in Tamil Nadu. So these three different scenarios perhaps is a good compelling comparative framework, I believe. Thirdly, Vijayabaskar's comment on local political culture shaping sort of negotiations over suspension of certain rights. And he also pointed the framework of party society in the context of Kerala. I have my own questions and doubts on that. Scholars have looked at West Bengal, argued sort of party society, how party society in West Bengal was very instrumental in bringing in certain kinds of desirable and undesirable outcomes. Kerala, a direct comparison is not possible, I believe, but I'm not delving into the details. Thanks for all the comments and suggestions.
Thank you, Dr. Vinita. And really, it has been indeed a very fascinating discussion and engaging discussion, and it throws up some larger issues with respect to the state-local relations and the local specificities and some innovative practices for managing this pandemic crisis. And I'm sure that today's discussion will be helpful in unpacking the black box of urban governance in Indian cities and to make better cities, which would be much more resilient to face this kind of addresses. And we would love to hear from your second round of survey as well, so in near future. So with this, let me once again thank you, Dr. Glyn Williams, thank you, Professor Debolina Kundu, Professor M Vijayabaskar, Professor Darshini Mahadevia, Dr. Karen Coelho, Dr. Vinita Thampi for joining us today. And I was thankful to all the attendees of today's City Conversation series. And we also hope that you will be able to find some time to attend our future City Conversation series as well. So we look forward to your participation in future. So thank you once again. Thank you once again from Team IMPRI. Yeah, good night.
Thank